Welcome back to BB Uncut, where we talk about health, wellness, and everything in between. Today we have a very, very exciting guest on the podcast. Welcome, Dr. Brad Leech.
Hi.
Thanks for having us. So, Brad is a PhD qualified clinical nutritionist and herbalist. He's internationally recognized for helping people with complex gut conditions and chronic autoimmune diseases. Through his busy clinical practice, he delivers personalized, science-grounded care and has mentored thousands of pracs worldwide in microbiome, paediatric, and autoimmune health. And so many of our pracs have done your courses, and they're big fans. And whenever any of the girls in the clinic are like, oh, what should we do? What course should we do? Everyone's like, Brad. So definitely do his courses if you haven't done them yet. So thanks for being on the podcast.
It's great to be here, and it's great to be chatting all things. And I believe we've got some really interesting topics that we're going to be diving into today.
Yes, I'm so excited. But before we dive into them, I wanted to know, tell me a bit about you and what got you into the space.
Well, we were talking off camera just before, and we both got into this profession at a very young age, which is a little unusual. I started doing Ayurvedic herbal medicine at the age of 15. I didn't know what Ayurvedic herbal medicine was. I stumbled into it. I just knew I wanted to study health. And then it just kind of snowballed where I was like, give me another degree and another degree. 12 years of university later, $100,000, and here I am now. I am a sucker for university and learning, but I love it. I love understanding the why as to complex health presentations.
100%.
So I love it.
So how did you do your medicine in that at 15?
I had to get a letter from my my mother and from my teacher at the time to basically say, yes, Brad's an exceptional student, and we support him going and getting this qualification at a young age.
That is so awesome. So if you could pick one thing that you enjoyed the most in your uni pathway, what would be the subject or the degree that you really feel like stuck to you the most?
I quite like the research subjects where you actually learnt all of those, and I actually went on years later and actually taught that exact same subject, the research subject, which I'm sure you would have done.
I fucking hate that subject.
The
worst subject, guys.
All about understanding how to read research and conduct research. So one side of me like that, but then if you go back to some of those early education I did, I'm actually a licensed massage therapist as well. And so in the training of becoming a massage therapist and an Ayurvedic herbalist, every Friday afternoon we had to practice on each other. And so you got a free massage every week during the semester. So that was enjoyable. Yeah.
I did my therapy as my side subject at Endeavour, and we got some release techniques, but it was a bit rough. Probably wasn't as massage therapy as yours.
Yeah.
So obviously, Balanced Beings, we treat a lot of kids. What would you feel like a lot of the root causes to a lot of kids' health issues are, and what do you feel like gets missed a lot of times?
I'm going to be a bit controversial here, and I'm going to say celiac disease, because about 80 to 90% of celiac presentations in paediatrics are undiagnosed.
Yeah.
And especially in our paediatric population, they can be asymptomatic. They may have some constipation, maybe some bloating, maybe some loose stools, but not necessarily. It's more the low iron, the fatigue, the poor weight gain. And sometimes it's not the first things our parents will think about.
Yes.
It's thinking about a chronic autoimmune condition.
Yes.
But it's one that gets missed. And if we can capture it early, we can prevent the iron deficiency. We can support with neurodevelopment. We can support with growth. It's one that's not captured, and we should actually be screening for it more frequently.
Yes. I actually love that you've brought that up. I had a client this week in the clinic with juvenile arthritis, and they're 8 years old, and no further testing was really done by the GPs. Obviously it's really common, they're really busy. But we went and did a microbiome stool analysis, and the transglutamized IgA was at 150, only ate gluten once a week. I was like, oh my gosh, it's so crazy.
Going on from there, doing further blood tests, doing a scope to get that confirmed diagnosis. And I understand, especially for some parents, weighing up those additional investigations. My advice is it's worth getting it done right. So stay on the gluten, get that diagnosis, so then because this is a lifelong diagnosis. And if we understand it at the beginning, then we know what we're needing to avoid.
Yeah, 100%. It's such an interesting picture that a lot of people are like, oh, celiac isn't that common, but it can be. And also when you're doing microbiome testing, remember that they have to be having gluten for it to even come up. So how often would you recommend that?
It's a difficult one when it comes around to doing that biopsy to understand whether or not there's celiac disease. The amount of gluten is almost equivalent to 2 to 4 slices of bread a day. It's a large quantity of gluten.
Normally I say 2 slices. That's interesting that you say the higher end.
On that to get that diagnosis.
Wow, okay. That's a lot.
It's a lot.
Wow. Okay.
Especially if it's symptomatic. So before removing anything, do that further investigation to ensure that we get that correct diagnosis.
100%. When you see children with stomach pain that's like relentless and continuous, what are your first thoughts that go through your head?
What have we missed? When there's a clinical presentation of gut pain, maybe bloating, constipation, we need further investigation.
Yeah.
We need to do a microbiome test. We need to do blood tests. We need to, ask questions. We can't use the same questioning style as we do with an adult population because they can communicate correctly with us.
Yeah.
So we need to utilise those specific questions to try and gather information. Where does it hurt and when does it hurt, and trying to bring additional information to thereby provide, what could be the driving factors behind these digestive symptoms.
Yeah, 100%. Is there any questions you find that are commonly missed for pracs that are treating children that you feel like need to be asked more?
Fatigue.
Yep.
Wound healing. Yeah, we're thinking iron here. Fatigue, wound healing, stomach pains.
Yep.
Yeah, location of the stomach pain, and bowel habits. I feel like a lot of pracs are going to be asking about bowel habits, but make sure you really ask those very personal questions. What does it look like? Does it float? Does it smell? Does it stick to the side of the bowl? Understanding those more nitty-gritties provides us as practitioners with that information.
Yes. And speak on that, a lot of what things we do in the clinic at BB is mums might be like, oh, I don't actually know. So, and the kid might be too young to answer and the kid doesn't know. So we say, okay, send me an email in 3 days' time and give me these things and look at the bowel movements in the next few days and then email it through to me. They don't have to know all the information in that initial consult. You can give them time to find that information and send it to you as well. I feel like people forget that that's an option as well. So it's super helpful. Awesome. What are things that you feel like with celiac? What kind of conditions have you seen that you didn't think was celiac and then ended up being celiac? Is there any cool cases that you could share with us?
There's a lot. The one thing that I'll note is once you develop one autoimmune disease, you're 3 times more likely to develop another autoimmune disease. And even within adult population, most people with a celiac disease diagnosis thinks all that they need to do is avoid gluten. But that's only to prevent that flaring of the celiac disease. But there's all these other factors that we need to consider. The bacteria in the gut, leaky gut, inflammation, immune regulation, when it comes around to preventing other autoimmune conditions being developed. When I think of an interesting case of celiac disease, it's asymptomatic. It's where you don't suspect it, but it's just low iron on a blood test. Maybe a little bit of fatigue as well.
Sometimes the signs aren't super obvious, and I find that for me, I will think, oh, this client's going to have such a high level of Klebsiella, they're going to have such a high level of X, Y, Z, and then I test them and they don't have high levels that high, so how much I'm expecting. And the clients, I think, oh, maybe I won't get anything from this microbiome report. And then there's these levels of bacteria or celiac that's super high, and you're like, wow, I wasn't expecting that. Like, symptoms, I feel like, don't always correlate to the microbiome results. You can't really guess who's going to have the higher levels, which I think is really interesting. It's so cool to know. With celiac, we were talking about how you're 3 times more likely to get an autoimmune disease if you've got an autoimmune disease like celiac disease. Besides treating the gut, is there anything else that you recommend to look at or treat to prevent any autoimmune disease coming on besides gut-wise?
4 driving factors. Yes, it's the gut, so dysbiosis, leaky gut within the gut, inflammation, and then immune dysregulation. So understanding what's their vitamin D levels. What about environmental pollutants, heavy metals? Can any of those go on and cause a immune dysregulation to thereby drive those risk factors for further autoimmune disease development?
Perfect. sometimes we're all about gut and then we forget there's other areas too to look at.
Many others.
Yeah, 100%. For kids, when you've got kids, say, with stomach pain and the parent can't do testing and it's just not within their budget, how do you distinguish between, is it gut or nervous system? Like, how do you distinguish without testing?
Without testing, okay. Because I would always say, well, the only way to do it is to...
Test, don't guess.
Test, don't guess. That's exactly right. Understand the correlation. Are the symptoms coming on with school, with friends? Are they there on the weekend? A question that I like to ask is, when you last went on holidays, how were your symptoms? You know, if you went camping on Moreton Island, or if you went down to Byron Bay and you're there for 5 days, you're outside of normal routine, did your symptoms stay, i.e. gut, or did they go away, i.e. nervous system?
And another one I find really interesting with this is when people are away and they feel like their symptoms clear, it can also be mold. I had a family that I was like, what is going on? Why are they 100% okay in Europe when they're eating worse? And we found a complete mold exposure in the house, which I was not expecting. So I feel like that's a really good factor to read. But yes, a comparison between holidays versus home, I feel like a lot of pracs miss as well, and something that we always ask in the clinic. That's super interesting, because I feel like not a lot of pracs have the option to test if their clients don't have the budget. It's
interesting you say that. So part of my PhD research, we looked at practitioners' views when it comes around to testing. Okay, and we had this cohort, and we asked them all these questions, and we did this analysis, and practitioners didn't want to spend patients' health dollar on testing. Okay, then we asked 680 Australians who have digestive-related symptoms, and these are adults. What are your views? And they said, we want the testing. We want to understand the cause. So there's actually a bit of a mismatch communication between practitioner and patient. And so we can't assume, we can't put our own financial burden or understanding on understanding what could be driving your presentation. I tell patients, if I have this information, I'm better able to support you. I have an understanding of what's happening in your gut, in your blood, and that translates to better care. I can do my job more effectively. Yes,
and I feel like patient communication is key, because from the pracs that we've mentored and trained in the past, I find that when they've got a financial view of like, oh, the clients don't want the testing, I found it's a really hard point, then it keeps being a hard point for them, and we actually have to mentor and train them through that financial kind of viewpoint to get them to help clients understand testing. And it's also a confidence thing. So if you're saying, like for pracs out there, I've talked about this a little bit before, but if you're saying to a client, oh yeah, I think a microbiome test will be for you, versus if you say, if we have a microbiome test, it's going to show us what overgrowth you have, what's causing the stomach pain, exactly how long to do treatments. We're not guessing which one's more likely to obviously get them to want to do the test. You need to have confidence in the test in order for the client to have confidence in actually paying for it as well.
And so then that's what confidence in the interpretation.
Yes, 100%. So I feel like that's something that's underestimated in practice as well. Back to autoimmunity. I love this question because you're so well versed in it. I just want to get all your info out. With autoimmunity, what would you say are the key things in the microbiome you see that cause that autoimmunity to actually come on?
Okay, so within the gut, dysbiosis, we might get a bit scientific here, can drive an increase in Th17 activation. It can cause a dysregulation of Treg cells. It can contribute to molecular mimicry, and it can drive up intestinal permeability.
Oh, I know that one.
So there's all these different microorganisms that can influence autoimmune disease development and exacerbation. We see it in rheumatoid arthritis, multiple sclerosis. They did this really interesting study. So that's an autoimmune disease of the myelin sheaths. They did this study where they actually got an individual with MS, took their microbiome and did an FMT, a fecal microbiome transplant, and they inserted it into an animal model and was able to actually induce multiple sclerosis. They've also done that with ulcerative colitis, but the other way around. They took a healthy microbiome and inserted it into a rodent study with ulcerative colitis, and it reversed it and put it into remission. So the microbiome has this power to exacerbate or put into remission when it comes around to an autoimmune disease.
It's crazy.
It's fascinating. I mean,
it's amazing.
should we
I love it so
quit our
much.
jobs and actually be fecal microbiome providers? We could actually be providing our own fecal matter.
I saw your post on April Fool's and I did not know it was April Fool's, and I was like, oh my God, this is going to be the best supplement on the market. And then I realised you were joking. I'm so gullible.
April Fool's, I did this post where I said, introducing my brand new product, Brad's Microbiome Capsules. And it's a photo of me of holding capsules, and I said it was freeze-dried microbiome from myself, but it wasn't April Fool's. It was quite funny.
Unfortunately, it was April Fool's. When you have autoimmunity or you see patients with it, how do you know, say that they don't know they've got an autoimmune condition, they're not coming because they're diagnosed. Is there a way that you know it's too far gone, that it's already going to be an autoimmune condition or not?
So that threshold.
Yes.
So, we can look at studies like lupus. So you can actually have antibodies for lupus 3 to 6 years before the diagnosis of lupus. They don't develop overnight. Okay, it's a slow progression.
Yeah.
Another neat example is slightly elevated thyroid antibodies in Hashimoto's or Graves. Sometimes when they're at that lower level, most conventional healthcare practitioners will go, well, no, that's fine. It doesn't meet that threshold of a diagnosis. Where maybe someone with a bit more alternative integrative understanding will go, yes, you're not at that threshold, but what can we do to prevent it from that full-blown Hashimoto storm? Let's control those driving factors now, so then it doesn't develop later on.
Yeah, 100%. That's so interesting. So when you see autoimmunity, how do you treat it? I'm assuming you work on what's actually going on in the gut and treat that.
Every case is different. And it's not like I have a set protocol of everyone that walks in, they get these 3 supplements, they get that particular diet.
Yeah.
We've got to understand what's driving it. Yeah. In my practice, I have a really comprehensive questionnaire that I send clients beforehand. And it's got all of these questions around heavy metals and mold, looking at epigenetics, early life exposures to stressful events, past infections, really understanding what could be their driving factor. Once we identify that driving factor, that's our treatment approach. So it's not sure, I will often do vitamin D. Yep. I'll check their vitamin D in accordance to what their levels are. I'll give them that personalised approach. But you get these books and these philosophies out there of the autoimmune disease approach. This is what you need to do to heal your autoimmune disease. And from a public health perspective, if you're eating a very unhealthy diet, sure, this might help. Yeah. But it's really understanding, well, what are those driving factors for you as an individual?
Yeah, 100%. Good to know. Is there any favourite products that you have you can drop for us? Favourite
products, as in like
I'm
ingredients?
Really trying here, guys. Yeah, you can go with key ingredients like HMOs, for example.
HMOs? It's not a bad one. From autoimmunity.
Yeah.
Active vitamin D.
Yes.
Yeah. Think rather than like D3 or D2, we can actually get active vitamin D to be more therapeutic.
Yes.
I don't mind HMOs.
Yeah.
So HMOs stands for human milk oligosaccharides. They are a prebiotic identified within breast milk. Now, there's a lab at the back of Toowoomba, and they've got about 40 to 50 lactating women all connected to these pumps, and they collect all the milk. I'm joking.
I'm like, that's not right. They're not from that.
No. That's a joke. It's through bacteria fermentation. And
if you didn't say anything, everyone would believe that. I was starting to think, have I got my facts wrong?
No. But believe it or not, it's a question that I get asked from clients.
Fair.
Human milk, is it from breast milk? Well, yes, it was originally identified in breast milk, but just like all other vitamins and minerals, they're made in the lab.
Yeah, 100%. So if someone had a strong family history of autoimmunity, besides picking up the autoimmunity meal book plans, what else could you recommend?
Get out in the sun. Get some vitamin D. Breathe. Make sure your nervous system is regulated. Exercise, 8 to 10,000 steps a day. Weight-resistant exercise, 3 to 4 times a week, 45 minutes.
Yep.
We said movement, we've said sunlight, eat a diverse diet.
Establish conditions for health.
Exactly. Little things, if you've got a family history of an autoimmune disease, yes, there's a increased risk.
Yeah.
Genetics load the gun, environment pulls the trigger.
Yeah.
If you don't expose yourself to mold, and if you have a healthy, balanced diet, you get plenty of vitamin D, low stress, in an ideal world. Sure.
Yeah. Like that's what I was explaining to one of my clients today. She said, my mum, has had cancer in the past. I think I'm going to get a hysterectomy. It's like, okay, let's talk through this. Mm-hmm. And yeah, it's really important for people to actually understand how it works, because people just assume my parents got that, I'm actually going to get it. Like they believe that.
Yeah. It's, thinking of paediatrics, thinking of autoimmunity, I've got a number of paediatric autoimmune cases under my care at the moment. And I recall one of them, a beautiful, beautiful family where, I've been working with the daughter who has ulcerative colitis. And then the mum's like, I'd like you to see my son. He's had elevated calprotectin. And we measured his microbiome and looked at all these markers. And, it's almost heartbreaking to be the one to say the odds of your son having a lifelong chronic autoimmune disease, it's very high. And eventually he got diagnosed with ulcerative colitis, the same as his sister. Although both in the same family, treatments are still very different. Mm-hmm. But we've managed to capture it early, and so we understand, what are those core philosophies moving on throughout life to keep it in remission as long as possible.
Yeah, really important. So interesting. I love autoimmunity. It's such an interesting thing. I've had clients where their autoimmune markers for hashies, their antibodies were at like 5,500. Wow. We brought them down to below 50. And one of the key treatments is she was severely vitamin D deficient as well. So activated vitamin D was like one of the key treatments. NAC worked really well with her, and she had low selenium as well, which doesn't help the thyroid too. So
myself and a colleague, we did a research article review on selenium and Hashimoto's and thyroid antibodies. And the dose is actually 200 micrograms to be most effective. Now, TGA in Australia says 150. So all products will have no more than 150 due to toxicity. Yep. But the research says the most effective dose to bring down thyroid antibodies was actually 200 micrograms. Yep. So we'll measure their selenium, we'll utilise that high dose, we'll measure it again, we'll do it short term to bring down those thyroid antibodies.
So interesting. It's crazy how much things can impact. And for people that don't understand, you can bring your antibodies down. It's possible to bring that down. A lot of clients will come in and not realise that as well, which is...
Another one on the thyroid antibodies.
Yes.
If they're really high, so I'm talking above 1,000.
Okay.
Red light on the thyroid. There's actually quite a few articles. And getting the right wavelength of red light therapy on the thyroid, it only works when it's really high thyroid antibodies. Okay. But a great option that's non-supplemental.
Yeah, that's really interesting. And would you say to do it until the antibodies have gone down?
The studies themselves were between 8 and 16 plus weeks.
Yeah.
I'd do it that length of time and then retest. I don't necessarily would do it all the time, but it's a good targeted intervention to help speed up that process.
It's very interesting. How do you remember all these research studies in your head?
It's what I do on the weekend.
How do you memorise things?
I have a really good memory. Okay. My wife will go, where did I put my keys 3 weeks ago? I'm like, they are under the drawer here. I don't know how I do it, but I just have this almost photographic memory. It's quite handy.
That would be so handy. That must be nice. Besides the thyroid antibody studies you were telling us, is there any cases of before and after you've treated autoimmunity and you're like, wow, I'd love to share this result?
I would say, a client, not paediatric, so an adult.
You can't share it.
He had blood in his stool. Typical man of going, this is normal. I think to myself, blood in the stool, that's not normal. He believed it was normal to have blood in the stool. Anyway, we eventually, through a microbiome test, said, yes, you've got inflammatory bowel disease. And he was like really adamant of getting on top of it. And he went above and beyond my initial treatment plan where he did a bit of fasting and other targeted interventions. He brought his calprotectin down from 1,200 to 150 in like 3 months, 4 months. It was like
I can't believe it was
phenomenal.
that high.
Very high.
Oh my God, I've not seen it that high before personally.
I've seen it higher.
I haven't seen it above 500.
Above 5, yeah. You can get 2,000 plus, but the case I'm thinking of, 2,000 plus, he eventually had his large intestine removed. So once it goes over that threshold, it's very serious.
Gosh, that sucks. That's crazy. I guess I see a lot of kids and mums, so not like too many autoimmune-based cases. I wouldn't see as many. Yeah. That's so interesting. Now, there's one thing that everyone's asked to learn more about, and I feel like it's something that everyone gets really stuck on and feel really uncomfortable treating, and it's SIBO.
Oh, okay.
So take me through what you think about SIBO, what you think about treatment, and then give us your words of wisdom. Okay, SIBO.
Now, it's one that really ramped up from about 2015. 2015, a good colleague of mine, Dr. Narala Jacoby, the SIBO doctor, she's brings SIBO to life in Australia, has done a really good job of bringing awareness of this overgrowth of bacteria in the small intestines.
Yeah.
Research has come out over the years to actually indicate high dose antimicrobial therapy, great short term, but the relapse of SIBO is about 40 to 60% of cases. You treat it with antibiotics or antimicrobials, 40 to 60% of the time, it comes back.
Yeah.
Well, hold on. Did we address the cause, or did we just mask the symptoms for a little bit?
Exactly.
My number one word of wisdom when it comes around to SIBO cases is visceral hypersensitivity. That's where the nerve endings in the gut are actually hyperreactive to all of these FODMAP foods, these fermentable carbohydrates, and that translates to bloating, abdominal discomfort, and we can do something called gut hypnotherapy, and that is basically a process of desensitizing the nerve endings in the gut, so then we're able to tolerate these foods. If we can tolerate these foods, we feed up the right bacteria, it helps to manage some of the driving factors behind SIBO.
Is there anything else you do besides hypnotherapy for visceral hypersensitivity?
Butyrate. Yeah.
So I swear to God, you say that for everything.
You know what? It does. You give me any condition, I can link it back to butyrate. Butyrate being a short-chain fatty acid, it's the most important compound that the gut produces. There's research to show that actual butyrate supplementation, which is now available in Australia, can actually reduce digestive pains and reduce visceral hypersensitivity in the gut. So increasing butyrate with something like PHGG, but also some gentle prebiotic fibres like chia, kiwi fruit, and maybe some flax seeds are a great way to support with visceral hypersensitivity.
Yeah. I saw a lady, I've never treated her before, she's one of my friends, and she went to a naturopath before she knew me, and she did 6 months of antimicrobials for SIBO, and then she's like, I felt great, and then it all came back.
Yeah, classic.
6 months. There'll be nothing left in there.
And that's the consequence of utilising. In some cases, I'll use these antimicrobials.
Yes.
I am a herbalist. Yes. But you use it for a targeted approach while doing the butyrate, while doing the visceral hypersensitivity, while slowly diversifying the diet. And the response from patients when they say, I can go out for dinner again and I'm not worried about onion and garlic and all these other fermentable foods, I'm not having a reaction. They're happy.
Yes.
They're very happy.
Yeah. It's life-changing for them. Like it truly is. It's such a good feeling when you successfully treat SIBO. But yes, they're very aggressive. You've got to be very careful with them. So when you feel like SIBO cases fail, what's the first thing that you'd look at?
Snacking. Snacking can impact that motor neuron complex. I'd be thinking about stress as well, thereby producing sufficient digestive enzymes and stomach acid. Motility, so coming in with motility agents such as ginger and gentian to support with that push down. In some cases, yes, apple cider vinegar. If it's not working, we need to understand the why. So, whether it's measure the microbiome, breath test, that's debatable. But we need to understand, is there another factor that we're missing? Yeah.
So when it keeps reoccurring and they keep lapsing, what would you say normally is the cause of, or do you feel like everyone's different?
Everyone's different, yes.
Yeah.
You know, there are some SIBO cases which are actually autoimmune related. In some SIBO cases, it's a lack of vitamin D. Sometimes it just needs a different view, a different lens of looking at it to go, hold on, you've missed this. You've missed these really specific targeted interventions that were never part of your protocol.
100%. I personally, every time I see a client, I look through their result again because I feel like I'm looking at it differently. Because it's just like, I feel like it really depends on what type of like mood or like you're in. I feel like it does change. I'm like, oh, what have I missed? What have I not looked at yet?
Yeah, the moon could be in retrograde. You know, Mercury's coming in and it just impacts.
I just feel like it's so helpful to look at it at the same time. Like, okay, I've done this. I haven't done that. It's really helpful because you can't do everything in one appointment, guys. Interesting. So what would you say are the go-to things that typically make SIBO worse, like probiotics and stuff like that? I feel like it can really flare it up.
Snacking is a big one that can flare it up. Some probiotics. Stress can typically make that SIBO picture worse. Exposure to the FODMAPs when we're not at that stage, that can flare it up a bit. Lack of exercise. That'd be the driving factors.
And so how do you know a client's ready to put the FODMAPs back in?
I ask them a question and I go, what food do you most want to eat again? Okay. And it's important to capture the food that they want to eat. Because sometimes people have been on a restricted diet for so long and fundamentally it's changed their view. So almost a placebo effect. Even though we may have treated the SIBO, if they ate a particular item, they would actually give themselves bloating. Okay. So if I ask them, what food do you actually want to eat again? And depending on what that item is, I generally start there. Because if I can do a food that they want to eat, they're psychologically wired in that they want to start eating it and thereby present with fewer reactions.
Less worried.
Yeah.
Interesting. And with the hypnotherapy, who does that?
So you can do it on your phone called Nerva. So it's just an app and that's what all the research has utilised.
That's so cool. I had no idea.
If you've never used it, Nerva. Okay, it's great. Nerva developed down of Monash University.
How do you spell it?
Nerva.
Okay.
Nerva. Monash University. Now, they have done multi-centre crossover studies in Australia, US and UK, where they have two groups of IBS individuals. And one group was told to follow a low FODMAP restrictive diet. The other group was told to do gut hypnotherapy. By the end, the ones who did the gut hypnotherapy had the greatest reduction in symptoms and continued to have a reduction in symptoms. Now, with those with the low FODMAP, as soon as they brought the foods back in, they started reacting. Few things to consider. You've got to do this whole course. So it's a 6-week course of a hypnosis meditation session, 15 minutes every night for 6 weeks. If you don't do it every single day, the success rate reduces. So you've really got to be compliant.
Okay. How long does it take, do you know?
About 15 minutes.
Okay, that's so doable for many people. No excuses, guys. And so stomach acid and pH, do you feel like a lot of people miss that or
we've got to think there's different pHs throughout the whole gastrointestinal tract. Mouth can be slightly alkaline. We go down to the stomach and that's very, very acidic. We want it to be acidic because that acidicness actually denatures these proteins, breaking apart the peptides down to the amino acids and releasing the iron, the B12, the magnesium, the zinc. Then we go into the small intestines and through bile and pancreatic elastase, it lowers down the pH. By the time it reaches the bowel, we should be at a pH of about 6.4, okay? If it's very acidic, so a pH of maybe 5.5, that's a very rapid transit time, very fast. Where if it's high pH, so 7.5, we're generally thinking of a slower transit time, so constipation. Butyrate can also be involved here. Butyrate is a short-chain fatty acid, okay? So if we've got an alkaline bowel, we can actually bring in butyrate to acidify the bowel.
That's so interesting. Love it. Thank you for your information. Now, I want to talk about all things babies. I've been looking forward to this part all day. Anything you want to add in SIBO or autoimmunity, anything you think we've missed?
Let's talk babies.
Okay.
I've got a baby, you've got babies. How old are yours now?
I wish they were babies. 5 and 7. They're turning 6 and 8 this year.
Okay, wow. I'm still, we've got one.
Yes.
He's Matthew's 16 months, 17, give or take. I love him to pieces.
That's a very traditional name, Matthew.
Yeah. Matthew James.
Oh, that's my partner's middle name.
Oh, wonderful.
Yeah.
That's my grandfather's name.
Oh, lovely. James.
I wanted to call him something like Radomir or Ziggy, something a bit more alternative. A wife would have absolutely no, she said, no, it's a traditional name. It was William or Matthew.
Oh, yeah, okay. Oh, well, Matthew's better than William, I think.
We love the Williams out there.
Yeah, well, I wanted my partner was like a bit like, no, I want it to be like, I don't want him to get paid out at school, but we settled on Sterling. Because it's like a strong name.
Spell that.
Sterling, like sterling silver.
Okay, love it.
Yeah. We'll see if it gets bullied.
My wife is South African and her name is
My
spelled...
partner's South African.
Oh, really? Whereabouts?
Cape Town.
Oh, okay. She's, I think Cape Town. Durban.
You don't know? Oh, Durban,
I don't know. Somewhere around that. But her name's spelled Karen, okay? But in South Africa, it's Karen.
Yes.
So it's like different, but everyone's calling her Karen, but her name's Karen. And anyway, we digress. Let's talk babies.
Yeah, so with Matthew, what are all the things that you did to prepare him?
Well,
to be healthy and not have autoimmunity.
So he did his first microbiome test when he was 5 months of age. And I remember the day because you had to collect the sample before it sat in the nappy for too long.
Yep.
And so, as babies do, they pull the poo face. And for Matthew, it's like this red look in the face and his eyebrows kind of come down here. And as soon as he pulls that face, I run over and I've got the swab and I collect the sample fresh and I take the swab and
Nick's like, what the hell is this world that they're talking about?
I send it away. Now, not everyone needs to do a microbiome test on a 5-month-old, but, this child is going to have a microbiome test every single year and we're going to track the data and watch his species grow.
That's so exciting.
It came down to even before birth.
Exactly.
We did a birth hypnosis session. It was like a full weekend course where we learnt hypnosis for births, and then it was a relaxed birth. I understand there's a lot of stigma out there around vaginal versus C-section, breastfeeding versus not. What I would first highlight is whatever you do, doing it to the best of your ability is perfect. If there is a C-section, that's okay. If you can't breastfeed, that's okay. There's ways that we can potentially change the microbiome, even though there are these risk factors that may increase the risk of atopic conditions, maybe autoimmunity. But I want to express that, being still in this young infant stage, there's a lot of judgment out there around how long did you breastfeed for?
Yes.
Or I'm still breastfeeding.
Everyone's always like comparing.
Let's
not compare. Let's just do what we can.
It's hard. It is really, really hard when you're in the trenches.
Yes.
Okay. To the point of my wonderful wife, she got mastitis. Okay. Quite common. But we knew that it was coming on. And so I open up my tool belt of, these are all the things that I can utilize. There's particular probiotics that can help to clear mastitis. She eventually needed antibiotics and a cyst drained of her breast, and it got quite bad.
Yeah, it gets bad quickly.
Very quickly. But even though she needed antibiotics, we remeasured her gut thereafter, perfectly fine.
Yeah.
Because we protected the gut. We came in with SB and these HMOs, we came in with different probiotics and prebiotics to really protect the gut during that process.
Yeah.
Perfectly fine.
She's probably thinking, I'm so sick of taking things from him.
Yes, a lot. She goes up in arms over it, but it's okay. We have a loving relationship. From Matthew, yes, we tried the vaginal birth, and yes, that was successful. We tried breastfeeding. I say we. I was there holding the hand. Actually, I delivered Matthew.
That's awesome.
At the very last moment, the obstetrician said, "Oh, do you want to come down this end?" And it was perhaps the most profound moment in my life, just to pull him out, and it was almost like a Simba lifting him up into the air, and then the umbilical cord is pulling on my wife's vagina. She started screaming, but it was such a magical moment. He's taken a lot of probiotics and prebiotics.
Yeah.
When my wife needed antibiotics.
Yes.
Okay. Little bit of antibiotics can go through breast milk, so we had to protect the gut at that same time.
Yeah.
when it came around to introducing solids, okay, we used to teach bring solids in at 4 months. From a microbiome perspective, ideally we want to bring them in at 6 months. We want the time for the microbiome to develop. We want a really strong bifidobacterium dominant microbiome. And so we introduce solids at 6 months, and we've got this chart, or we had on the fridge, with 100 different foods to try in that first 6 months, introduce 100 different food items. A lot of it is still on the walls, but diversity.
Yes. Explain to everyone why diversity in 100 foods is important.
Okay, first we've got texture, and that whole texture, sensations. We've got key nutrients like iron, but we want to build up the microbiome. During those first year and a half, when diet is pretty simple, diversity is going to be low. Over time, it increases. As soon as we start bringing in solids and diversifying the diet, those bacteria will increase. A diverse microbiome is a healthy microbiome.
Yeah. Very interesting. And what about pregnancy and preconception to help bubs with their microbiome? What would you say here?
Yes. When we think about translocation and where the microbiome actually comes from, 40% from a vaginal birth microbiome comes from the mother's fecal matter. And so watching my wife give birth, there was more fecal matter than you can imagine. I do not know where it came from. It was absolutely everywhere. That's good. She had a good microbiome going into it. So it's almost part of the preconception phase of let's correct the microbiome.
Yeah.
There is some early research to show microbiome and preconception can go hand in hand. But as soon as you know that you're pregnant, let's implement these prebiotics, maybe some probiotics, support the microbiome, so then we're seeding the microbiome with healthy microbes.
Perfect. And if someone's had reflux or colic in the past with their previous children, is there anything specific that you'd be like, okay, let's focus on this before they fall pregnant or for early life for bubs?
I don't know. Do you know?
I find that when the microbiome is good, then that trapped gas doesn't get trapped.
Okay, because there's probiotics like Lactobacillus reuteri DSM, which can be used for colic. I bought some. I had some there in my stash, ready to go in case Matthew was a colicky baby. That would be my first intervention.
Just not having that intestinal dysbiosis present from the get-go is the biggest thing.
Yeah. And increasing that bifidobacterium, because the first month or two, the gut, if you measure the gut and look at it, it would be terrible, but that's normal.
Yes.
Yeah. We want to make sure that there's bifidobacterium, and that helps to balance things out, to regulate the immune system.
Yes, 100%. It's very interesting, hey? So what's the number one bacteria you wouldn't want a 1-year-old to have?
A 1-year-old?
Yeah.
Any E. coli, Klebsiella type bacteria, by the time that they're 1 year of age, they might have a little bit in there, but if it's, 1%, 2%, 10%, that's problematic. I've seen a number of 1-year-old cases where they have an elevation of these species. We bring that down with maybe HMOs, maybe with a binder like a serum bovine colostrum, maybe even some probiotics, and their symptoms improve.
Yeah, that's awesome. Thank you. And in regards to pregnancy, is there anything that you would say would be really important to get that microbiome perfect for baby diet-wise for mums?
Doesn't need to be perfect, because anyone who is pregnant or has been pregnant knows in those couple of months, it's toast with Vegemite. It's just eat food. Don't worry that you may not be having the most diverse diet, but as soon as you overcome that morning sickness, and for some individuals, like my wife, she vomited 263 times.
Counted.
Yeah, she had nothing else to do, and so during that kind of 16 weeks, her diet was basic. Okay.
Mine was Macca's fries for 10 weeks straight, all I ate.
Perfect. Okay.
Every single day, because I couldn't stomach anything.
And that's just what you do. Hence why we do preconception.
Yes.
Before you conceive, doing all these interventions, because there's nothing worse than trying to take a handful of supplements and prebiotics when you're feeling nauseous.
Yes.
Once you can, great, diversify the diet. there is some research to show more plant-based foods in pregnancy translates to a healthy microbiome in infancy.
Yeah.
So more beans, legumes and lentils.
Yeah. And what about allergies with kids? How does the gut microbiome have a role in allergies?
Generally, we need an initial trigger. And so that's maybe early antibiotic use, early formula, cesarean, a dysbiotic microbiome, mold exposure. We need a trigger. And then we can have a reduction in those key immune modulating microbes, such as the bifidobacterium.
Yeah.
When they're low, especially in the first 6 months of life, that can almost train or not train the immune system to thereby have these atopic-like conditions.
Yeah.
And so it's about, well, we can use targeted probiotics to actually regulate the immune system to reduce the reactions. A big one here is, I think of a client that I had just last week, formula. Okay. Now, in many cases, formula it's needed, but choosing the right formula, one that's maybe lower allergenic. So I have a preference for goat milk formula rather than cow's milk formula. Simply, and we got the feedback from the client just last week, simply by changing the formula, the eczema improved.
Yeah. It's really can be those simple switches that people don't think of as well. So it's always looking at the whole case.
And omega-3.
Yes.
Yeah. As a targeted intervention.
Yeah. And what made you pick omega-3s?
Anti-inflammatory, supports with regulating the immune system. Typically, most kids don't eat a lot of omega-3. And you think about your omega-3 ratios, you actually get it from mum. So, and you can't necessarily increase fish during pregnancy because of the mercury toxicity. So we've got to make sure that there's that balance of omega-3.
Yes, 100%. And when you see pracs that are managing food intolerances or food sensitivities, where do you feel like people go wrong with this?
Not bringing them back. Yeah, it's very easy to look at whether it's an IgG or an IgE response. If it's IgG, so that's like an immune sensitivity, we've got to make sure we bring them back in.
Yeah.
Heal and seal, bring it back in. When it's an IgE mounted response, so that's an actual allergic reaction, we can work with an immunologist to actually do minute amounts of said allergen while supporting the gut, coming with targeted prebiotics, and over time, and this is 18 months plus 2-3 years, able to tolerate those foods again. Takes a lot of time. It's $10,000 plus when it comes around to fees and supplements and all of that. But can you imagine any mother out there or father who has a child with a IgE immune response, peanut allergies, anaphylactics? Wouldn't it be nice if you could flick a switch and not have that? Not need to worry at birthday parties, not need to worry when going to school, oh no, will they have a reaction? Yeah. So doing it as soon as possible.
Yes, is always key.
Yeah.
We've had clients that have been dairy, allergic to dairy, allergic to egg, and what was the other one? Allergic to peanuts, and work with allergists and been able to actually reintroduce them after we treated the gut. And that was like life-changing. They couldn't believe it. Yeah. And it's possible. And it's so
takes
amazing.
Time.
It does take time. You've got to remember 12 months minimum.
Yeah. Patience.
Yes, which a lot of people don't have these days and want instant results. While I'm on the topic, what children would you say benefit most from HMOs? I know that you're a massive HMO fan. Besides nitrate.
I'm a benefit of HMOs.
You're not?
No, I do. I love them. The reason I like HMOs is they're low reactive.
Yes,
so you can give it to someone who is sensitive and they're not going to react.
Yes.
Okay, there's nothing worse than giving a prebiotic supplement and causing further reactions. HMOs, well, 2FL specifically, found in breast milk, feeds up bifidobacterium. And in that particular case, if an infant or a young child has low bifidobacterium, it's one of the best ways that we can actually increase it. Yeah. It's more effective than actual probiotics when it comes around to increasing bifidobacterium.
Yes, which is really interesting. Yeah. And with food sensitivities, I feel like so many pracs are really scared to reintroduce because they're so scared. How would you support them and give them recommendations on getting them to feel confident enough to reintroduce because they're so scared of doing that? Because I feel like that's what's stopping a lot of them.
Yeah. Making sure you've got a good protocol in the sense of healing and sealing the gut, because a lot of these food sensitivities, not allergies, but sensitivities, can be a response of like almost like a leaky gut type picture. And if we can address that, take the ingredient out for a period of time, 4 weeks minimum, maybe 2 months, and then slowly introduce it alongside, once we've healed the gut, one at a time. Slow and steady.
Yes. Yep, and not do a lot at the same time either. Like even if it's one food group, do it every 48 hours. Give the body time to respond, which I feel like everyone's like, oh, you can introduce it now, but then they don't give any guidelines. Give guidelines.
Small amounts.
Awesome. Oh my God, we've gone through so much today. I'm really excited. I have a question. So someone on the grapevine said that you used BB Kids Eliminate sometimes.
I sure do.
By the way, guys, that's a supplement that I decided to make. So take us through, if you don't mind, talking about what makes you, in what cases do you find that it's suitable? Because it's obviously not going to be suitable for everyone.
It's one of those things with, I wish I could recall all the ingredients. Let me just grab one of these bottles.
You can grab a read if you want.
And I was actually looking at the tech sheet the other day.
Pomegranate.
It's got Nigella in it as well.
Nigella in it.
Being an Ayurvedic herbalist, I love the black Nigella.
It's so hard to get for kids. I feel like it's impossible.
And that's the thing. I am very much of the stance of we don't want to use high-dose antimicrobials.
Yes.
Okay? We don't want to be introducing high-dose antimicrobials in our paediatric population. So I'm very selective.
Older ager.
Yeah. I'm very selective on the antimicrobials that I would utilise. I'd rather not use alcohol-based interventions in paediatrics.
Yeah.
I'm looking for one that tastes nice. I'm looking for one that has those key ingredients. I like the pomegranate and I like the Nigella. So there are some situations where there are pathogenic infections. So not necessarily at the need of needing antibiotics, but based on our microbiome test, we can see that there is a pathogenic infection occurring. They're at a young age and it's probably one of the better ones, probably the only one on the market that tastes nice. The dosages are appropriate for that younger age and to be effective.
Yes. Oh, thank you. That's such a nice thing to say. I feel like, it's got a lot of good macros in there, like the echinacea, pomegranate, black Nigella, like a good blend, cinnamon, ginger. Anyway, I won't talk about it all day, but thank you for your words of wisdom. Do you feel like I've gone through everything I want to ask you? Autoimmunity. I'm sorry, I've gotten so much out of you.
SIBO, autoimmunity, HMOs.
So this is 3 podcasts, guys. You're welcome. So thank you so much for joining us on the podcast. Is there anything that you want to add or anything you want to talk about before we wrap up?
I think we've covered a lot.
We've done everything that I wanted to do. I'm
impressed. Lots of questions. I look forward to listening to it and coming out.
Awesome. Thank you so much for coming along. I really appreciate it.
You're welcome. It's been great chatting.
Yay. Thank you.